Good morning, y'all. I am here. Leota, I
I am
see
also
you.
here.
And I see Kelly.
Here I am.
Okay, so do I get an approval for our last meeting that occurred on October 8th, please?
So moved.
Second.
Thank you. So on item number 4, we have the interlocal agreement with Dustin County Prosecuting Attorney's Office for Prosecution Services, City Attorney's Office.
Good morning. This is going to be a
Morning.
low-tech presentation. Basically, this is a renewal for another 2 years of our prosecution contract. They've proposed an increase of $20,000 for 2025 and just over that with a minor escalator for 2026. Otherwise, there are really no changes in this agreement. It's been a long-standing, productive relationship, and we recommend approval. Moving it to the December 3rd consent calendar for approval. And I'm happy to answer any questions if you have any. Otherwise, I would love to have a motion.
I will move that we place the interlocal agreement with Thurston County Prosecuting Attorney's Office for prosecution services on the December 3rd, 2024 City Council consent calendar with a recommendation to approve and authorize the mayor to sign.
I'll second.
I second also. So
All in favor?
all in favor?
Hi.
I just, in that discussion, Peter, just want to say, Karen, it's been really helpful to have them come more regularly and show the type of cases and the backlog and the challenges from the pandemic and moving forward. That's been really helpful. And I think when we have that communication and that sharing, it helps us easily support these increases because we see what they're working on and how it impacts people in Tumwater. So thank you for that.
Good. We will continue to try to do that. Thank you very much.
So on that note, we are up to item number 5 on our agenda, and that's also interlocal agreement with Olympia for Mark Noble Regional Training Center, and that is from the fire department.
Yeah, good morning, council members. Sean Crimmins, Deputy Fire Chief. I'll be providing this overview of, really, we kind of talked with the fire chief about, really just kind of explaining what the Mark Noble Regional Fire Training Center is. So we're just going to talk a little bit about that, and then just also what the interlocal agreement is. So I'm going to share my screen here. Everybody see the Mark Noble stuff up there?
Yes.
Perfect.
Yes.
All right, so first wanted to kind of explain what is the Mark Noble Regional Training Fire Center. And really going back, it's actually named for Mark Noble, who was an Olympia firefighter. He actually started back in 1984 at McLean Black Lake Fire, or McLean Fire Department. I actually had the opportunity to work with him way back in 92 at McLean. So great firefighter, great officer there at McLean. He actually went to Olympia Fire shortly after there in the mid-90s. Was diagnosed with cancer and actually ultimately died with line of duty death back in 2005. During that time, prior to his death, though, he was very instrumental in cancer awareness, cancer prevention, and that's how the training center out there became known as the Mark Noble Training Center through his Mark's commitment to firefighter safety, training, and just making sure our firefighters are ready for the inherent dangers and the challenges that we face on a day-to-day basis. So just a little brief overview of why it's called the Mark Noble Training Center. As far as the training center itself, what we're talking about today is an interlocal agreement between the city of Tumwater and city of Olympia for a year, basically it's $90,000, 90,400 for a 1-year agreement, which is the same exact price that it was last year, just for a little bit of context. And what do we get with that? Well, it's an 8-acre state-of-the-art facility. So it has lots of props on it. It has a commercial drill tower, which you can kind of see down there in that right lower picture where our fire engine is spraying water very effectively at the non-burning structure. There's a 2-story residential tower, which is the one on the bottom left. And there's also ventilation props and a very comprehensive drill area, which you kind of see on that right upper area. We also utilize that for auto extrications and just numerous other drills that are not just us, but really us, Olympia, Lacey, other departments in the county are able to utilize this, along with, we do have our Fire Academy, the South Sound Recruit Academy utilizes this drill ground as well. Talk a little bit about that commercial tower. Inside of it, it's state-of-the-art. It has a commercial stove fire prop, a Class 1 hood fire prop, and a ceiling flashover fire prop, which is that picture right there. That's it doing its work. It gives a very realistic opportunity for our firefighters to receive their every 2 years, they're required to have live fire training, and this enables our people to stay up to date with state standards, national standards. Also, the commercial tower has 2 stairwells, which offers standpipes and fire department connections. And that's really handy, as even here in Tumwater, as we continue to see apartments and other businesses getting taller. This allows our crews to train for those more high-rise type of structures to be better prepared. Also has forcible entry doors and some bailout windows, which is helpful in training our people how to properly and safely get out of a structure if they have to. Another area on this training center, on the training grounds, is a command center, shown in the pictures up here. First top is the exterior. The bottom one is the interior of this command center, along with a classroom. So what it really offers is the ability to do real-time and really in-depth incident command training on all types of fires, residential structure fires, commercial structure fires. But it also just provides critical class space and the ability to have classes such as our Fire Officer 1 and 2, which are required through our Journeyman Apprenticeship Training Program through the state. Incident Safety Officer and Instructor 1. Those are just a few examples of some of the classes that we're able to hold at this training facility. And really, that's it. Pretty short and sweet. The recommended action that we're looking for is that for you guys to place us interlocal agreement with Olympia for use of the Mark Noble Regional Training Center on the November 19, 2024 City Council consent calendar with a recommendation to approve and authorize the mayor to sign. And with that, certainly happy to answer any questions you may have.
Chief Crimmins, I guess my question is, if this wasn't available, what would that look like? Would you have to go to multiple places? Would you have to go up north? Like, what would happen if this wasn't available?
Yeah, great question. We would be pretty hamstrung on where we'd be able to do these types of trainings, right? Used to be, a lot of times we'd utilize empty parking lots or that type of stuff, but that's a big impact. We really don't have the space anymore to be able to get everybody together. The other really beautiful thing about this is it's a safe, secure location. We don't have to worry about anything because it's really only going to be the fire EMS people that are going to be in there. So yeah, to answer your question, it would be very tough. We would probably have to go north or figure out we do have some other smaller areas, but this is pretty ideal for us to partner with Olympia and Lacey as well.
Thanks, Chief.
Yeah.
Peter, I don't have any more questions. I'm in support of this.
I have a question. So, Chief, I don't see the city of Lacey mention here? Did they have their own training center, or did they have a partnership with some other entity beside Olympia and Tumwater?
So they would have their own interlocal with Olympia for use of the facility as well. They also do have their own, they call it kind of the training center out, it's out Station 34 off Stillicum. So they utilize some of their own stuff, but they also have an agreement with the city of Olympia as well.
Thank you.
Yep.
So on that note, any other question from anybody? Do I get a motion to move?
Yeah. Peter, I'd like to move to place the interlocal agreement with Olympia for use of the Mark Noble Regional Training Center on November 19th, 2024, City Council consent calendar with a recommendation to approve and authorize the mayor to sign.
I'll second.
Okay. Do I get a vote?
Aye.
Aye.
Aye. So that is done.
Thank
So
you.
the sixth, thank you. So the sixth item is also an interlocal agreement with Olympia for Fed Cares program, the fire department.
Sure. Thank you, Councilmember Agabi. I have a quick request for Laura. Our presenter is an attendee, Serena. Would it be possible to make her a panelist for the presentation?
Let me see what I can do.
Okay.
And this is FD Care.
Does Chief, does she have a presentation, or
Yeah,
I can
she has.
allow her to talk, but I can't make her a panelist unless she goes
Okay.
back out and comes in
Yeah.
as a panelist.
Okay. Well,
Brian, can she email the presentation to you?
sure, that's possible too.
Why don't we go ahead and authorize her to speak, Laura, and then she can email the presentation to Brian, and we can go from there.
Okay, here we go.
I'm sending it now.
Thanks,
Good
Serena.
morning, Serena.
Good morning. I was looking at this going, why can't I see myself? But that makes sense. Sending now.
Well, I just wanted to open the introductions, but I also see Chief Matt Morris on from the Olympia Fire Department. And I'd introduce Serena Belovich, who is the CARES Program Coordinator for the Olympia Fire Department. So I don't know if either of you would like to kick things off, Chief Morris for us, and I can then get the slides up when I receive them.
Absolutely. Thank you, Chief. Good morning, everyone. Council, Mayor, I appreciate the opportunity to be with you this morning. And so I apologize. I'm going to leave my camera off. I'm home with a little bit of a head cold. I took a trip to the Midwest this weekend and seemed to bring back some Midwest junk with me. So I apologize. We're just super excited about our CARES program in the City of Olympia, and it's, you know, the best way to make these things successful is to do them, you know, regionally, and you know, we're all better together. And these types of services that are so important to our communities are really difficult for people and our agencies to do independent of each other, and the opportunity to kind of work together to kind of, you know, these needs don't stop at the borders between cities and between jurisdictions, right? And so the opportunity for us to kind of partner and share our resources and do these things together, I think, is ideal. And so Serena and Chief Hurley have worked really hard on coming up with a way for us to do that. And I'm super excited for them to share that with you. And so I'll kick it back to Serena or Chief, and then I'll take any questions anybody may have.
Thanks, Chief. All right, and I'm just receiving this here, so. All right, so I'm going to attempt to share my screen here. So how are we doing?
Okay.
Looks like I'm in the, all right.
Okay. Can everybody hear me okay?
Sure
Yes, we
can.
can hear you.
Okay, good. So I wanted to just share a little bit, just a quick presentation about the Olympia Fire Department CARES program. So CARES, if you go to the next slide, Chief Hurley, CARES stands for Community Assistance, Referral, and Education Services. So ultimately what this is it gives fire departments an opportunity to be able to offer community, members or people visiting our community, staying in our communities, some additional assistance, education, and connection to resources that they may not otherwise know about. It's really an opportunity for post 911 follow-up calls and in a sense, when we have, calls that come into 911, there's typically a specific reason for that call. If you really take a look at, going out to those individual homes, though, the reason for that initial call may not actually be, the only reason why that individual might need help. If you wouldn't mind flipping to the next slide. So in 2019, the Olympia Fire Department began a non-emergent care coordination and referral services program here, for the city of Olympia. And a lot of that was phone-based referral services and care coordination, connecting people to resources in the community. And then in 2023, the city approved an expansion of services that allows for the CARES program to be implemented in a more widespread way. So having a multidisciplinary team approach is a big part of this. Social workers, medical professionals, getting connected with, additional resources for services is huge for people that, are dependent on 911 or just maybe are new to the community and don't have a primary care provider, things like that. But it also allowed us for in-person contact with those individuals and not just trying to connect them to resources over the phone. So getting in front of people was a big part of that 2023 expansion of services. So partnerships like the Tumwater Fire Department partnership allows us to reach people outside of just the boundaries of Olympia, expanding into a community that ultimately touches the capital city, but a lot of people are using resources in Olympia. Tumwater residents are already coming to Olympia to utilize hospitals and other medical resources, so it makes sense for us to connect them to other services in the areas also. In reverse of that too, it also helps us to be able to connect people to services in Tumwater that we maybe just haven't been able to partner with previously. So, if you're looking, if you want to flip slides, thank you. If you're, considering the Olympia and surrounding communities, of course, it's full of culture, history, opportunities, and fire departments take care of people, whether they're here to work, live, visit, or play. But we also have resources and support services that a lot of people just aren't aware of. So when someone calls 911, we're arriving to their home or wherever the call generated from to serve and listen with the goal of providing the right answers. But what if the individuals that are there at that moment are firefighters or medic teams, they don't have those right answers? Because there's more than just a medical need there. Maybe there's a social support need or an additional social services, social work need. Maybe they need medical care coordination, things like that. So CARES is really a unique program that's committed to community-centered support services and generating positive incomes for the communities that we, live in, work in, play in, serve. The Oh, if you want to flip slides, thank you. The community really tells us what they need. So this, different reasons why CARES might be implemented is, 911 dependency, caregiver service needs, food assistance, medication, mental health supports, substance use supports, housing concerns, finding a PCP, health supportive services that are beyond just medical care, or helping them, navigate things like insurance, Medicaid, Medicare. And then we also are, working on fall risk assessments while we're there, trying to prevent, be proactive in some of those calls, and then also some facility follow-up. So about 20% of clients referred to care services are referred more than one time. So looking at, this list, this is just a small portion of the reasons why they might be referred initially, but then, there may be more than one thing, sometimes more than 2 or 3. So CARES is a unique program that's committed to connecting people to those community-centered support services so that we can achieve positive health outcomes within the communities that we're serving. So our services ultimately, provided by CARES will result in healthier communities. You can flip to the next one, please. We are offering individually tailored short-term case management and supportive planning for these services. So we have an opportunity really to mitigate some of those risk factors, looking at, what is it exactly that's going on with those individuals, and then connecting them to 2 or more services within the community. In the end, we're increasing the overall well-being of people. A lot of times people are needing some support and either don't know where to find it, or they just, haven't had positive interactions and maybe need a little bit of, we'll say, conduit support, someone in the middle that's able to just help them maybe understand the information differently, or, just someone that can advocate for them in a different way. If you would flip to the next, we have a graph. So this is just an example of October of just last month, some results that we had. And as you can see, 46% of the referrals that or the attempts to contact people were successful. 46% doesn't seem like a huge number, but when you're looking at the overall, number of individuals that were attempting to contact, the reasons for not being able to reach them is, not for lack of trying. So leaving information at a residence, or maybe just unable to locate them. Maybe they don't have a permanent address or a permanent phone number. But then each time we receive a new referral, we can make new attempts. We try to connect with people, more than once. We're not just making a phone call if they have a phone number. We might leave a message with a neighbor or drop information off at their door. We're working on, making as many attempts at contact as possible. So that 46% number, almost 47% successful contact is the people that we've been able to reach, that we've been able to connect to services, and we've been able to have those one-on-one conversations with them to find out what is it exactly that you're needing. And then the next slide shares a little bit about outcomes. So if we're looking at overall service outcomes, how many times were goals set for individuals in that month? So as you can see, there's a lot of goals, 205 different outcomes. So that shows that out of those 34 individuals, there were 205 different attempts to connect them to, to services or to different resources. And so that percentage is much higher. So the small portions of, leaving a card behind or leaving a voicemail, we had 205 attempts, and out of those, we were 60% successful in reaching people. So looking at, overall livability, so connection to community resources, healthcare coordination, referrals to services, improving quality of life overall is really a high level goal of this program. And then equity too, looking at, who deserves to have services, offered to them. Everyone does. So we want to connect people to sustainable tools and culturally competent social service and mental health professionals that can continue to work with them long term, not just in the short term when CARES is involved, but maybe long term, for a very long period of time, and being able to keep them in these healthy spaces. Overall, like when we're looking at livability, equity, these are, two things that everyone strives to have. And I believe that our CARES program is able to connect people with supportive resources that overall not only are improving health outcomes, but also just really social supports and mental health outcomes too. That's all I really have to offer for you guys today, but do you have any questions for me?
It looks like Councilmember Dahlhoff has a question, and yes.
Thanks, Chief Hurley. And I don't know if this is for Serena or Chief Hurley, but two questions. One is, how does the FD CARES program overlap or differ from the Scout program that we're moving forward with? And then can you give me a scenario of what this would look like in Tumwater for FD CARES
Sure.
and Scout? Like a call comes in to TCOM, right? How is that dispatched and how would that work?
Yeah,
Yeah,
go ahead.
I would just say for, just to start off, and then maybe Serena could follow up, they definitely are different programs that, the CARES program, those are going to be primarily referrals from our engine company crews. So these are going to be our crews going out and contacting somebody in their home or wherever they're located and seeing a need, and they will have a mechanism to refer those to the CARES staff. Whereas the crisis response model, you are correct, that would be more through TCOM, more of an immediate interventional kind of situation in the moment, whereas the CARES program is more of a longer term case management. And I'll let Serena follow up on that.
Exactly what Chief Hurley said. I'm familiar with the Scout program, and they are definitely, it's an emergency. In the moment, they're doing co-response. A lot of times the CARES program is more follow-up to those calls and other calls that are received when they're, seeing things that are maybe not emergent in that exact moment, but are going to require a little bit more tailored connection with those individuals and being able to keep them connected to services a little bit longer term. It also, really helps with care coordination connections to other service providers in the area. So larger organizations that are doing long-term case management and care coordination, where Scout primarily, is working with mental health and emergency services. We're going to be working with more of those lower level needs that are becoming preventative care and trying to keep us from becoming emergency.
Okay, I appreciate it. So what I'm hearing, I'm just trying to put together, is we do things the way we've always done it, but these are two examples of the FD CARES and the Scout program of seeing community needs and meeting community where they're at and adjusting and providing an update. So I love this. I think this is great. Thanks, Serena, for coming. I appreciate it.
Councilmember Von Holtz.
Thank you. I love this. And I know, especially when you're dealing with community members who might be in a mental health crisis, getting them early before it is like a crisis situation where they have to go to Western State Hospital, getting them the care and the services in their own community where they already probably have supports or at least familiarity with the area instead of shipping them off to Lakewood. I think really helps meet the community where they are. And so I love this. I also love, Serena, you mentioned making sure that fall risks. And I have a grandmother who had fallen several times, and then finally it got to the point, and if there would have been like this type of where the family could have been more alerted, she would just call 911, they would come, nobody would really realize it could have maybe prevented her from having to go into assisted care because we could have gotten a caregiver in to check on her more often. So I love managing expectations, and I love setting a foundation to make our community stronger. And so this is great.
So
Yeah.
I do have a question. So in terms of so the point of contact to the individual, how does that occur? And because
Sure.
more than likely that individual probably have other services that they are receiving. How do you coordinate services or wraparound services with that individual service providers? Say, for example, social services or mental health.
Yeah, I'll let Serena speak to how they reach out and contact individuals.
Yeah, so couple of things with that. If we're looking at this as like a community risk reduction, right? So much like fire prevention or other programs, this really becomes like a proactive. We're kind of trying to get ahead of some of those things. We are trying to prevent some of those emergencies from happening. But when someone calls 911 and emergency services are needed, the crews are able to obtain information from those individuals, asking them, could we have someone do a follow-up call with you? So we just call saying, basically kind of our intro to them is, we're calling as a follow-up to a recent 911 call, and we're wondering if there might be something more we could, help you with outside of emergency services. And so those, it either happens through a phone call, or we'll drop by the residence and leave some information behind. We make multiple different attempts, to reach individuals until we're able to make that initial contact with them. It's all free. It's all voluntary. We're not, mandating anyone to engage in any services, but we're giving them the opportunity to connect with us. And then we just ask, kind of do a little bit of an assessment with them. Ask them what are some different domains, health domains that you might need some assistance with. So we ask some really specific questions related to safety and different areas of healthcare need and things like that. And then through those questions, we're able to determine what are some initial goals that can be set for those individuals, and how can we help them, to meet those goals. Does that help answer that question?
Yeah, so I have a follow-up to that. So if I were if I were in that situation and I said I don't want any services, would you make a referral to the more traditional service provider in the community?
Yes, as long as it meets HIPAA, requirements. So there are some areas that we can do some care coordination without an ROI, and then there are some areas that require an ROI. So it really would depend on, what that identified need is. There are, obviously there are some areas that fall under police or fire that are emergent, and you don't have to have an ROI for that, but there are some things that we would need to request that they sign a release of information so we can share specific details about them to maybe a primary care physician or someone that we're trying to connect them to. But a lot of the services, yes, we can make referrals, leaving out any major identifying information or anything that, might violate any HIPAA guidelines.
Okay, thank you. Any other question? So on that note, do I get an what's it called?
Motion.
A motion to place this on our consent calendar?
I move to place the interlocal agreement with Olympia for FD Cares partnership on the November 19, 2024 City Council consent calendar with a recommendation to approve and authorize the mayor to sign.
We'll second.
So on that note, I vote yes.
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 So
Thank
we move
you.
to Thank you, Chief. The next item on our calendar is the resolution 2024-015, affirming the council commitment to equality, dignity, and protection of civil rights and standing against hate, bigotry, and discrimination. The Executive Department.
All right. Hey, good morning, Councilmember Agabi, members of the Public Health and Safety Committee. I'm here to deliver a resolution that staff was invited to bring to this committee. And the topic is, as noted, Resolution R 2024-015, affirming the Council's commitment to equality, dignity, and the protection of civil rights and standing against hate, bigotry, and discrimination. The reason why recent events at the national, state, and local levels have highlighted the need for our community to take a stand against hate and the violation of civil rights and reaffirm our shared commitment to justice, equality, and human dignity. This resolution, to put it in a really succinct form, is about asserting that we stand for kindness and we stand for belonging in Tumwater. So as you know, this resolution has been brought to you before. The revision to the resolution adds more on the approach of hearing directly from people with lived experiences in our community and working alongside and learning from neighboring communities' approaches. Councilmember Agabi is aware, and I'm happy to report that the mayor and staff and Councilmember Agabi, among other council members, have been meeting with community members to gain insights. Staff have added supportive material to our website, including links to resources for those who may have experienced a hate crime or who are concerned about hate crimes in Tumwater. And this action not only provides a values-based foundation for our work, it also supports our strategic priority to build a community recognized for quality, compassion, and humanity. So staff's recommended action is to recommend that this resolution affirming the council's commitment to equality, dignity, and protection of civil rights and standing against hatred, bigotry, and discrimination go to the full council for approval at the November 19th, 2024 meeting under consideration topics. That concludes my introduction to the topic.
So I guess the question then would be, the last time we brought this resolution forward, there were some additional language that were anticipated that would be added, and we haven't seen that. Do you know what those language?
It was. I can read it aloud if you prefer, but
it was in your
No,
console. No. 1 second. Do you mind showing that on the screen, please?
I will do my very best here.
Thank you.
Jason, one thing as you're doing that, when we see things in multiple revisions, it is helpful to see the track changes just as we move forward to track the changes.
Yep. Okay. I'm a bit new to this also. Let me see if I can start with the sharing.
You're doing great, Jason.
All right. Let's see. One second. I believe at this moment I am sharing a screen.
Yes, you are.
Okay. And you'll see there the City Council Commitment to Action section. Let me see if I can blow that up just a little bit.
Can you blow it up a little bit?
Yep, that's what I'm working on here.
Thank you. Now work. Thank you.
Okay. Were you able to take that in?
Yeah, so the area that I'm particularly concerned about is that if I recall the last time we talked about this or spoke about this, the discussion was, well, we need to be able to add more language to the resolution, and this language has to be related to community involvement. And at that point in time, my discussion was we cannot bind community entities to a resolution that the city is proposing where the city does not have the capability or the wherewithal to enforce any to enforce that. So the language that we ought to be looking at would be where those community entities have been included in this resolution or spoke about, either one.
I mean, I can say, as I said in my introductory comments here, is that the city is currently working with the various members, thought leaders in the community of Tumwater, as well as surrounding communities, and seeking perspectives, gaining lived experiences, working with the League of Women Voters on multi-city events, trying to actually gain a footing and foundation for the potential of taking additional action, such as an equity commission or some other like activity. And so I think this is what I'm referencing here, or what we are referencing here as we wrote this and went through our legal processes. And so the exploratory work is what is there as the attempt to gain perspectives that would then lead to that community involvement and engagement.
Okay. So Councilmember Dahoff, it was your idea that we include the community entities or talk about them in this resolution. Does this speak to what you were what you have envisaged? And if it does, how does this make this how does this make this resolution enforceable?
First, thank you, Jason, for judging, right? And I think it's going in the right direction. And then to go back to Peter's, well, we can't, right? When I read the updates and I dig it, and then I think, well, where are the people who gave us the examples of what they experienced? Where are they in this, right? What does that look like, right? And so I feel like we're getting there, but I still don't want a resolution just to be words. Like, what are those actionable items, right? So Jason has made great updates, and I still don't think it's sufficient for moving forward. And that's not anything that Jason's done, but it's just that conversation.
Well, to be, Congressman Dafoe, you have to be very, very concrete, because this is our second attempt. To be actionable, enforceable, you have to propose a language that proposes to do something that the city has the wherewithal, have the means to enforce. For example, if I'm going to go from here to Costco, it's either I'm walking to Costco by foot or I'm driving over there, in which case I have a means to get there. In this case, a resolution from the city with this language you say it has to be actionable. And actionable, I don't have a dictionary in front of me. And actionable, to me, means enforceable, or there is some kind of ramification that resolution proposes to address. So
I hear what you're saying, Peter, and I don't see
provide this
actionable
language,
and enforceable as the same. Those are two different things for me, right? An ordinance is
Okay.
enforceable. A resolution, I feel, is just a statement of what we want, right? So that's the difference for me. An ordinance is enforceable. A resolution, I feel like a lot of times it's just been words of stating this is what we believe, but there's been a missed opportunity for what that means in Tumwater. So I think we have a little difference in definitions, but I understand what you're saying. I know that Kelly has some examples. I think this is good, and I think we could move it. I mean, we should move it to have just an overall council discussion, right? That this is ongoing work, and it's not going to be perfect, right? Nothing is perfect. I believe in continuous improvement. So I get it. I just, when I read it, I'm just like, where are the people that have actually had experience and have reached out, and they still have not been connected to? That's where, so maybe it's not in the resolution, but that ongoing conversation. So when you're out in the community talking, who are you talking to? And are we not dropping the people who've had experience and tried to reach out and didn't get a response?
Kelly, will you have your hands up? You have your hand up.
Yeah, so I'm hearing for the first time that these community discussions have taken place. I was initially invited by the mayor to be a part of those conversations, and I have not been invited to any of them, nor have I heard any feedback of what those conversations have looked like. So that's a little I don't know. So if a community member had asked me, are these conversations taking place? I would have no knowledge. Neither would, I believe, not to speak for Council Member Dahlhoff, but as a council member in general, even if I hadn't been told that I'd be invited to these conversations, we haven't received any kind of update on them. There are some things I think that we can look into being a part of, because I very much don't want this just to be words on paper. I want this to be Tumwater walking its talk. And so I wonder if we couldn't reach out. Project Kindness is something that Aaron Jones in our community is working on. And so we don't have to reinvent the wheel. Is this something that the city could either mirror or take part in with Aaron Jones? Also, Tumwater is the only community in Thurston County that has a cultural center. And I think that a lot of discussions and a lot of input can be found right here in our backyard. And so I want to know what kind of discussions are being taken with the cultural center here in our community, and how more things can maybe be done to partner. So especially our community members of color, we're meeting people where they are in our community, and just making sure that, again, this is a great start, but I want a little more oomph to it, so it doesn't just look like words on paper. Also, is there anything around the equity toolbox, that work that we could put into the resolution, that work that's already been done?
So I am going to, I think we are all missing the bigger picture of what this resolution, of what we're proposing to do. A resolution are words on paper that speak to a particular subject. They don't necessarily address a particular issues because it is a resolution. If we want the resolution to speak to other modalities in the community that will address issues, that comes from the city's policies, procedures, and what have you, and our RCWs. But this is not what that does. So, again, my opinion, we're talking, but we're not actually talking about what we're doing. If we have our commission would be in a position to address this, and our commission would be in a position to have the capabilities to do that, because they are charged with doing that. They will have the policies and procedures. There is no policy standing behind this resolution. This is just a words on paper that is probably going to be posted on our website, and that would probably be the end of it. It doesn't go anywhere after that.
Peter, I hear you, and that's what I don't want to happen, right? I wanted this to have some gain momentum, to have a quicker timeline for the Equity Commission and the work that you are contributing to, right? That's why I don't want to just be words on paper. Then always, let's just not do it then. If we want to have that discussion about just not doing it because it's words on paper and it'll just be posted online, then I don't want to do it. If this then incentivizes and gains momentum to get that Equity Commission and that engagement in our community moving, then I'm for it. But that's a valid question. If this is just words on paper, then I'm inclined to just say, no, then I'm not interested.
All right. On that note, since this has been brought forward, if any how are we to handle this going forward? Do we take a vote and say we don't want to do this anymore, or do we just let it be?
Like, do you mean save it for the Equity Commission? I mean, I would love.
We can't save, we cannot save anything for the Equity Commission that we have not approved nor disapproved.
This could be a draft for them to continue moving forward. It's an option, right? Or do we say, yeah, let's make a statement of where we're going together. So I'm inclined to send it to council and see if they want to have a conversation, but it really goes back to you and Kelly, what you're feeling of what you want this to do and where to go. I'll support both of your decisions.
For me, on a personal note, I propose we advance this to full council. And if council has anything to add, they do. And if council say, well, you know, thank you, we don't want this, and that's what that is. But for us to keep harping on this, it doesn't help our cause.
Kelly, what are your thoughts?
I mean, I just have that concern, Peter, of what you said, that it's just put on the web and then the momentum loses steam. And so, but I also don't want it not to move forward. So I'm in favor of moving it to council.
So on that note, Leila, what do you think? So now we have, she's moving forward, I'm moving forward.
I'm moving forward.
Okay. So do I have a resolution then to move it forward?
Well, it sounded like you made the motion and Kelly seconded it and we all just said aye.
Okay, aye, okay. On that note, I think we moved it to, we'll move this resolution 2024-015 to full council for whatever they do with it.
Consideration. Well, thank you. Appreciate this. And
Thank you, Jason.
Thank you, Jason. So item number 8 is additional item, and I told Leila this morning that I have a 9 o'clock meeting with someone at work, so I am going to be leaving about 3 minutes. So does anybody have any additional item besides what we've already discussed?
No.
Okay. On that note, I think we are adjourned. Thank you very much, people. We have a great day.